Everyone, and today our topic of discussion is rheumatological history and rheumatological examination. So, different conditions they come under rheumatology, and rheumatoid arthritis and systemic lupus erythematosus, osteoarthritis. So, basically, like here, why I wrote rheumatological examination and history is because I want to tell you how to examine the uh, joint conditions and how to take history relating to any um, abnormality with the joints. Okay, so first of all, to talk about the history, uh, remember whenever there is any uh, medical condition occurs with the joints, the most common type of sign or symptom will be like pain and swelling. Okay, so pain and swelling uh, is the most common sign or symptom you can say, which you will be saying, or the symptom. Of course, the pain and the swelling, the patients complain, but when you see, like, you can see the swelling as well. So, again, like we asked about the onset, duration, progression, the distribution, and the joints involved. Okay, uh, very important thing. Like we can ask the patient, of course, there are many joints in the body, and I cannot be specific with one joint, because uh, just to show you how we examine the joints, I gave you the example of shoulder, which is a complicated one. But in history, okay, there are many joints, like, knee joint is there, ankle joint is there, wrist joint is there, elbow joint is there. So joints are many. The small joints of the hands and the feet are also there. So uh, we see the patterns, like either it's articular versus non-articular, either it looks like inflammatory versus non-inflammatory, either it's acute versus chronic, either there is peripheral versus axial, or either there is uh, one joint is involved or many joints are involved, and if many joints are involved, what is the distribution of the joint involvement. Because again, like when you will study rheumatology, you would know uh, what I'm talking about here is because there are many conditions which affect the peripheral joints, but there are many conditions which affect the central joints, and there are many conditions which affect like one joint, and there are many conditions which affect like many joints, right? So pain, swelling, stiffness, stiffly is especially we ask about morning stiffness, we ask about loss of motion, we ask about loss of function. Okay, like these are the symptoms you can say, uh, which the patient present, and or what we can ask. Okay, so maybe the patient will complain that I cannot move my muscle, my joint completely like as I used to do it before, or I cannot do this function like opening a can or holding a key, which I used to do before normally, right? uh, any weakness, or there could be a symptom of weakness, and changes in sensation sensations. Okay, so and many rheumatological conditions, like they give like extra articular manifestation as well. What is extra articular manifestation? Simply the sign and symptoms which are other than the joint involvement. For example, they can give many signs in the eyes. They can see give many of them. They give signs as skin rashes, okay, or like fever or fatigue, or you can say ulcers, okay, or rashes. So many of the rheumatological conditions they present at this way as well. Okay, so like simply in the history, when the patient can present with these things, you have to inquire about these things. Okay, so like if anyone is coming with pain and swelling in the joint, you will ask like which joints are sore or involved, right? Is it like one joint or several joints, or are the joints which are swollen, they are red or not? Okay, because like when they are red and swollen, it means arthritis, inflammation of the joints, and if they are not so, it means arthralgia. Okay, are they getting better or worse, or if there is any pain in the morning or after exercise? Okay, when there is pain upon early in the morning, like upon wakening, we call it as morning stiffness. And is there any history of trauma? Okay, is there any pain during the night time? That points toward malignancy when the pain is during the night. If the pain started suddenly, so think about the fractures, okay, or trauma. So morning stiffness is very, very, very important sign. And when you will study, for example, rheumatoid arthritis, you would know why I'm saying you this thing. Okay. So now there are many causes of monoarthritis, like which affect one joint, or there are many causes of polyarthritis, which affect many joints. For example, septic arthritis is an example of monoarthritis. Um, Gout is an example of monoarthritis. Okay, osteoarthritis is an example of monoarthritis, but rheumatoid arthritis is an example of polyarthritis. And osteoarthritis can be the example of polyarthritis as well. So, like this way. So we inquire about all the signs and symptoms, when we take the history, and then of course we ask about social history and all this history, family history, drug history, and all these things, right? So when we go for the examination of the any of the joint, guys, the important thing to mention here is, okay, I am just let's say, of course, like I cannot tell you how to examine all the joints, like, but the joint which I choose today is called as shoulder joint, right? It's a quite complicated joint because the range of motion is too much. Whenever we examine any joint, okay, we go from the approach called as look, feel, and move, and then we perform special tests and then check the neurovascular bundle. So whatever you are examining any joint, always go in this way, that look, inspection, feel, palpation, and move is like you have to move the joint both actively as well as passively. Okay, when you have to move yourself as well, and you have to ask the patient to move it for you as well. Okay, so uh, whenever we examine the joint, again, there are many ways to remember the things, like how to see the things when you look for like when I look any joint, I think about swift, SWIFT. S for swelling, W for wasting, I for any signs of infection or incisions, F is for fasciculation, T for tremor. So like this way, right? So I have like some set mnemonics to remember the things. So whenever I okay, let's talk about shoulder examination, then we would understand. Okay, so the first thing is wiper, wash hands, introduce yourself, position, exposure, and right side of the patient. Okay, so today I need to examine your shoulder joint. This will involve looking, feeling, and moving the joint. Does everything I've seen make sense? Are you happy for me to examine your shoulder joint, expose patient upper body appropriately, position the patient standing, ask if the patient has any pain before you begin. So see, look. What are the things you will look? So it is general inspection, right? Or look is the first principle. Of course, like here, we will see the general appearance of the patient, okay? And then we are examining the patient, especially the shoulder joint, okay? So look, and when we look, by the way, the first principle is like always to compare the right and the left, okay? Remember that the joints are three-dimensional structures, and they need to be inspected from the front, the back, and the sides, okay? So inspect the skin for any erythema, or what we can call it as redness, okay? indicating any underlying inflammation like arthritis. Look for any atrophy, okay, any scars, which will tell any previous surgery or trauma or any like tendon repairs, any rashes, for example, psoriasis, right? So now, why psoriasis is important? Because psoriasis, also involve joints. Okay, psoriasis is associated with a rash and polyarthritis. The psoriatic rash consists of scaling erythematous plaques on extensive surfaces. Sometimes the nails are also involved, right? And also look for a vasculitic skin rash, a palpable purpura, or anything. In that one, the joints can be involved as well. Okay, so look for any swelling over the joint. Okay, because swelling means can be a sign of effusion, hypertrophy, or inflammation of the synovium, or a bony overgrowth, like what happens in osteoarthritis. Okay, so see a lot of things we look for. Okay, whenever we whenever we examine any patient's joints. Okay, so for example, if you found swelling in the lower limbs, right, then it may be due to fluid retention or edema, right, which is of course painless and without inflammation most of the time. So painful swelling, remember, they mostly results from inflammation, like from anything. Look for any deformity. Deformity is a sign of chronic, usually destructive arthritis and ranges from any type of deformity can be there. Any range of deformity can be there. For example, Charcot's joint, what happens in diabetic people. So look for any muscle wasting. Look for any subluxation of the joint. Okay, subluxation or dislocation. Okay, so dislocation is simply, when the uh, you can say when there is a loss of contact between the joint surfaces, right? But subluxation is when the displaced parts are not at the normal position, but they are still in contact. So look for muscle wasting, especially in the shoulder joint. Look for the deltoids, how they look like. Okay, and all the things. Okay, of course, like we look like in shoulder joint. Okay, we examine all these things whenever we examine the shoulder joint. Okay, so see, like now you are thinking that it's a very 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 long procedure just to examine the shoulder. Like how you will remember all these things and how much time it will take. By the way, guys, it takes less than 30, like 15 seconds, you can say. Okay, so in reality it takes less than 15 seconds just to give a good look around the joint, just to catch like if they have any deformity is there or not, right? So as we know, the shoulder is the most mobile joint in the body. It involves like three bones. There is a clavicle, the scapula, and there is humerus as well. And there are a few joints, like one of the joints is called as acromioclavicular joint, which is formed by the acromion of the scapula and clavicle. And the joint type is ball and socket joint, or you can also call it as glenohumeral joint, glenoid process and all this. And there are 17 muscles which are involved, which are moving our shoulder. And this joint is stayed stable because of the force of four, or the stability is provided by four muscles: supraspinatus, infraspinatus, teres, minor, and subscapularis. If you don't remember anatomy, guys, I think open Google and just type one thing that is called as rotator cuff muscles, and everything will be in front of you. So, of course, like it's a capsulated joint and it is lined by synovium, okay, and it's a complicated joint. It's a complicated joint, and it is frequently involved with many arthritic or bony as well as non-arthritic conditions like inflammation of the bursas. Bursas are around them. There are many conditions, which occur to the shoulder, like stiff shoulder or frozen shoulder can be there. Adhesive capsulitis or tendinitis or bursitis, all of these things can occur. So the shoulder joint can be dislocated as well. You can catch that thing when you are checking the symmetry between the both of the shoulders. Okay, so sometimes when the person falls on the outside hands, there is anterior dislocation occurs. Anterior is more common in shoulder joints, guys. Okay, so of course, like the patient, they present due to some symptoms like pain, which I already discussed. Okay, or like a deformity or like stiffness or instability or dislocation, things like this. So that's why we are going to examine them. Even when the examination of the shoulder basically starts like as soon as the person started undressing. So it's very good to watch the patient undressing and note any forward, backward, or upward movement of the shoulders. And whatever these seem limited, okay, and then we stand back and we compare the both sides of the shoulder. Okay, sorry. So look, and then look from lateral, and then look from the posterior things. Okay, posterior part. So when you will see, look the shoulder from the lateral side. Again, you are looking for the scars, contours, muscle wasting, alignment. And when you will look for the posterior side, again you will look scapula, winged scapula, trapezius muscles, paravertebral muscles, and all these things, right? So look from three sides, and then feel. So we feel for tenderness, we feel for swelling, we stand behind the patient, rest one hand on the patient's shoulder, and move the arm into different directions. As the shoulder moves, we feel that acromioclavicular joint, and then we move our hand along the clavicle to the sternoclavicular joint, okay? And we feel all these things. Feel the temperature also. Like the warmth, of course, suggests like some inflammatory or infection is there, okay? So we feel all the joint. And the third thing is, of course, move, okay? So now, one thing you must know: what is flexion, what is extension, what is abduction, what is adduction, and what is circumduction. So the zero position of the shoulder is when the arm is hanging by the side of the body. So the palm faces forward, and then we check abduction, okay? And then we check the flexion, we check the elevation, we check the adduction, and to what degrees they are possible. They are written over here. You can read, you can pause over here, you can read over yourself, right? So then we ask the patient to perform certain maneuvers. I'm going to show you them in the video, right? Like over there, you are going to you are going to understand them better. And so look, feel, and move. And after that, we are going for some special testings. Okay, so you can see like what muscles are there, how what degree of abduction can be done, what degree of flexion can be done, what degree of extension can be done. If there is crepitus with the movement, so think about osteoarthritis. Okay, so then there are special tests we do. Now, how we do special tests, I will show you the video as well. There is something called as impingement syndrome, rotator cuff tear test, and shoulder instability test. And these are the name of the tests: drop arm test, empty scan test, and apprehension test, and painful arc or near sign test, and Hawkins test. Okay, so again, this one is showing you like the painful arc syndrome when the person, this is the joint when they put their hand up like this, so you know they have a pain in this arc. Okay, that is called as painful arc syndrome. Okay, what is near sign? So near sign is done, or it is to evaluate the area under the acromioclavicular joint which the rotator cuff should pass through, stabilize the patient's scapula. Okay, how it is done, of course, like the things, or how Hawkins test is done, or how drop arm test is done, or how empty can test is done. So, or how the apprehension test is done will be shown you in this video. This is the Hawkins test.
The Hawkins test is performed by forward flexing the patient's arm to 90 degrees, bending the elbow, and forcibly internally rotating the humerus. This drives the greater tuberosity under the coracoacromial arch, impinging the supraspinatus tendon.
And how the near signs can be checked.
For near sign, stabilize the patient's scapula with one hand, then pronate the affected arm and passively forward flex her arm as high as possible. This pinches the rotator cuff muscles under the coracoacromial arch. A positive test is any pain reported by the patient.
So see, whenever the patient have pain, of course, it shows like some sort of impingement or muscle problems. And this is like how
With the patient standing, perform the drop arm test for a rotator cuff
shoulder
tear,
drop arm test should be
specifically
done.
a supraspinatus tear. Ask the patient to raise her arm to the side as high as possible and then slowly lower it to 90 degrees. When there is a rotator cuff tear, the patient will not be able to hold her arm at 90 degrees and it will drop to her side. With the patient standing, perform the drop arm test for a rotator cuff tear, specifically a supraspinatus tear. Ask the patient to raise her arm to the side as high as possible and then slowly lower it to 90 degrees. When there is a rotator cuff tear, the patient will not be able to hold her arm at 90 degrees and it will drop to her side.
And this is like the shoulder empty can test.
To perform the empty can test, the patient is sitting or standing. The examiner stands lateral to and in front of the patient and places the patient's arm into 90 degrees of shoulder flexion in the scapular plane, elbow extension, internal humeral rotation, and pronation of the forearm so that the thumb points downward. Once positioned properly, the examiner stabilizes the scapula with one hand and places one hand on the superior portion of the mid forearm to perform a brake test to the motion of abduction in the scapular plane. A positive test is indicated by pain or weakness and may indicate one or more of the following involving the supraspinatus tendon: impingement between the humeral head and the coracoacromial arch, tendinitis, and or a tear of the muscle or tendon.
Okay, so and after that, like we do check the neuromuscular bundle in shoulder joint. We can check the sensation around the deltoid region. Okay, that's the important thing. Like depending on the upper arm, upper limb, lower limb, whatever you are checking, like then we check for that. So one of the thing is called as Apples scratch test. We stand behind the patient and ask the patient to scratch their back, or scratch their back, or scratch from up to the opposite scapula. Okay, so we see like how far they can go. Okay, reaching behind their leg, from behind their neck, reaching from in front of their neck, or reaching from the back. Okay, so this is called as Apples scratch test. Okay, so that's why it is called a scratch test, because we ask the patient to scratch themselves, reaching from behind the neck, from in front of the neck, and from the back. Okay, So this apprehension test and this, if you can see, this empty can test, what I show you is like how they do this thing. See, like the person is emptying the can. See the hand. If you have a Pepsi can in your hand, and if I will ask you to empty them, see, you will twist your hand like this. So that's why it is called as empty hand can test. Okay. So this is how like we do the shoulder examination, and simply whatever examination we will do, like either it's a ankle, knee, elbow, or wrist. Okay, we go by the same approach. We go for look, feel, and move, and then we go do special examinations, special test, and then we check the neurovascular bundle. Okay, so you can see over here there is like one more slide for the hand exam. See, inspection, look. So these are all the things you can look for the hand. Of course, like these are all related to some rheumatological conditions. Psoriatic nails. So look the palms also, look the elbows also. Feel, palpate. Okay. She's checking the temperature. She's checking for tenderness. She's palpating all the joints. And move. They are checking the thumb movement. Okay. Adduction, opposition, and then we check for, okay, these are the special tests, by the way, and then we check the neurovascular bundle, sensations. Okay, so this one. Okay, so this is how we approach all the examination of all the joints. Okay, look, feel, and move. So thank you guys so much, guys, for listening. I will see you next time.